Welcome to BoxedIn Health, where knowledge and wellness converge, sparking transformative journey to better you. Today we uncover the topic of depression. Depression, known as major depressive disorder, is a prevalent and significant medical condition that has a detrimental impact on your emotions, thoughts, and behaviors. The good news is, it's something that can be effectively addressed. Depression brings about feelings of deep sadness and a disinterest in activities that once brought you joy. This can manifest in various emotional and physical challenges, ultimately affecting your performance both in the workplace and at home. Depression can manifest with a range of symptoms, varying in intensity, including feeling down or having a persistently low mood. Children and adolescents might display irritability rather than sadness. Loss of interest or joy in once enjoyed activities. Changes in appetite, leading to weight loss or gain unrelated to dieting. Sleep disturbances, either trouble sleeping, insomnia, or excessive sleep, hypersomnia. Fatigue and a noticeable decrease in energy levels. Heightened, aimless physical activity or, conversely, slowed movements or speech, to a degree observable by others. Feelings of worthlessness or persistent guilt. Challenges with concentration, decision-making, or clear thinking. Experiencing physical discomforts like headaches, stomachaches, or sexual dysfunction. Increased irritability or a tendency to get easily frustrated. Thoughts revolving around death or suicide. For a diagnosis of depression, these symptoms must persist for at least 2 weeks and cause a noticeable deviation from your usual level of functioning. It's crucial to investigate potential general medical causes, such as thyroid problems, brain tumors, or vitamin deficiencies, as these can mimic depression symptoms. Depression affects a significant portion of the adult population, estimated at about 1 in 15 adults, 6.7%, annually. Over a lifetime, 1 in 6 individuals, 16.6%, will grapple with depression. While depression can arise at any age, it often makes its initial appearance during the late teens to mid-20s. Additionally, depression is more prevalent among women, with approximately 1/3 experiencing a major depressive episode in their lifetime. Genetics play a substantial role, with around 40% heritability observed when immediate family members, parents, children, or siblings, have experienced depression. Difference between depression and sadness, grief. Losing a loved one, facing job loss, or going through a breakup are profoundly challenging experiences for anyone. It's a natural response to feel sadness and grief during such times. Often, those grappling with loss might label their emotional state as depression. However, it's essential to recognize that feeling sad is not the same as experiencing clinical depression. Grief is a normal and individualized process, sharing some similarities with depression. Both can involve profound sadness and a retreat from regular activities. But they differ significantly. Grief involves waves of painful emotions, often intertwined with positive memories of the person who passed away. In major depression, persistent low mood and reduced interest, pleasure, dominate for most of 2 weeks. During grief, one's self-esteem usually remains intact, but major depression often brings feelings of worthlessness and self-hate. Grief may bring thoughts of death, imagining reuniting with the deceased loved one. In major depression, thoughts often revolve around ending one's life due to feelings of worthlessness, an inability to cope with the pain of depression, or a belief that life is undeserving. Grief and depression can exist together. The loss of a loved one, job loss, or experiencing physical assault or a significant disaster can trigger depression in some individuals. When grief and depression coexist, the grief tends to be more intense and prolonged compared to grief without depression. Differentiating between grief and depression is crucial. It enables individuals to seek the appropriate help, support, or treatment they need to navigate these challenging experiences. Types of depression. Clinical depression, major depressive disorder. A diagnosis of major depressive disorder indicates persistent feelings of sadness, low self-esteem, or worthlessness for most days over a period of at least 2 weeks. Other accompanying symptoms may include sleep disturbances, loss of interest in one's pleasurable activities, or changes in appetite. This form of depression is severe and highly prevalent. Persistent depressive disorder, PDD. Persistent depressive disorder, formerly referred to as dysthymia, involves mild to moderate depression that persists for a minimum of 2 years. The symptoms are less intense than those seen in major depressive disorder. Disruptive mood dysregulation disorder, DMDD. DMDD primarily affects children, causing chronic and intense irritability alongside frequent anger outbursts. Symptoms typically manifest by the age of 10. Premenstrual dysphoric disorder, PMDD. PMDD is characterized by mood symptoms, such as extreme irritability, anxiety, or depression, that occur alongside premenstrual syndrome, PMS, symptoms. While these symptoms tend to improve shortly after the onset of menstruation, they can be severe enough to significantly disrupt daily life. Depressive disorder due to another medical condition. Various medical conditions can induce changes in the body that trigger depression. Examples include hypothyroidism, heart disease, Parkinson's disease, and cancer. Treating the underlying medical condition often leads to an improvement in depression symptoms. Specific forms of major depressive disorder include seasonal affective disorder, seasonal depression. This type of major depressive disorder typically emerges during fall and winter and subsides during spring and summer. Prenatal depression and postpartum depression. Prenatal depression occurs during pregnancy, while postpartum depression manifests within 4 weeks of delivering a baby. The DSM categorizes these as major depressive disorder, MDD, with peripartum onset. Atypical depression. This condition, also known as major depressive disorder with atypical features, exhibits slightly different symptoms than typical depression. Notably, it involves a temporary mood improvement in response to positive events, mood reactivity, alongside increased appetite and heightened sensitivity to rejection. Individuals with bipolar disorder experience episodes of depression alongside manic or hypomanic episodes. Risk factors for depression. Depression can impact anyone, even individuals who seem to have a relatively ideal life. Various factors can contribute to the onset of depression. Biochemistry. Differences in specific brain chemicals can play a role in the manifestation of depressive symptoms. Genetics. Depression often has a familial connection, meaning it can run in families. For instance, if one identical twin grapples with depression, the other twin has a 70% likelihood of experiencing the illness at some point in their life. Personality. Individuals with low self-esteem, those easily overwhelmed by stress, or those with a generally pessimistic outlook on life are more prone to experiencing depression. Environmental factors. Prolonged exposure to violence, neglect, abuse, or living in poverty can heighten an individual's susceptibility to depression. Having certain risk factors increases the likelihood of developing depression. For instance, the following conditions are associated with higher rates of depression. Neurodegenerative diseases such as Alzheimer's disease and Parkinson's disease. Stroke. Multiple sclerosis. Seizure disorders. Cancer. Macular degeneration. Chronic pain. Depression stands as one of the mental disorders with highly effective treatment options. A significant majority, ranging from 80% to 90%, of individuals dealing with depression ultimately respond positively to treatment. Virtually all patients experience some degree of relief from their symptoms. Before proceeding with a diagnosis or treatment plan, a thorough evaluation by a healthcare professional is crucial. This evaluation encompasses in-depth interviews and physical examinations. In some instances, a blood test might be conducted to rule out potential medical causes like thyroid issues or vitamin deficiencies, which can manifest as symptoms resembling depression. Rectifying the underlying medical condition can often alleviate the depressive-like symptoms. The evaluation aims to pinpoint specific symptoms, delve into medical and family backgrounds, consider cultural and environmental factors, and ultimately lead to a diagnosis and a well-planned course of action. Medication. The chemistry of the brain can play a role in an individual's experience of depression and is a significant consideration in their treatment. Consequently, antidepressants may be prescribed to help regulate the brain's chemistry. It's important to note that these medications are not sedatives, uppers, or tranquilizers, and they are not addictive. They typically do not have a stimulating effect on individuals who are not dealing with depression. Antidepressants might yield some improvement within the initial week or two of usage, but it could take 2 to 3 months to observe their full benefits. If a patient doesn't feel a significant improvement after several weeks, their psychiatrist may adjust the medication dosage or suggest trying a different antidepressant. In some cases, other psychotropic medications may also be beneficial. Informing your doctor if a medication isn't effective or if you experience side effects is crucial. Psychiatrists often recommend that patients continue taking medication for 6 months or more after their symptoms have improved. For some individuals at high risk, extended maintenance treatment may be advised to reduce the likelihood of future depressive episodes. Psychotherapy, also known as talk therapy, is sometimes used on its own to treat mild depression. For moderate to severe depression, psychotherapy is often combined with antidepressant medications. Cognitive behavioral therapy, CBT, has proven to be highly effective in treating depression. CBT is a type of therapy that focuses on problem solving in the present. It helps individuals recognize and modify distorted or negative thinking, aiming to shift thoughts and behaviors towards more positive responses to challenges. In psychotherapy, the sessions may involve just the individual, but they can also include others. Family or couples therapy, for instance, can be valuable in addressing issues within close relationships. Group therapy brings together individuals facing similar challenges, offering a supportive environment and enabling participants to learn from each other's coping strategies. The duration of treatment varies based on the severity of the depression. It may last a few weeks or extend much longer. In many cases, significant progress can be achieved within 10 to 15 therapy sessions. EACT, electroconvulsive therapy, is a medical treatment primarily used for individuals facing severe major depression that hasn't responded to other therapies. This procedure involves a brief electrical stimulation of the brain while the patient is under anesthesia. Typically, a patient undergoes EACT 2 to 3 times a week, totaling 6 to 12 treatments. The process is generally overseen by a skilled medical team, including a psychiatrist, an anesthesiologist, and a nurse or physician assistant. EACT has been in use since the 1940s, and extensive research over the years has resulted in significant enhancements and the acknowledgement of its effectiveness as a mainstream treatment, rather than being seen as a last resort option. Complementary therapy refers to treatments that can be utilized alongside conventional Western medicine. For those dealing with mild depression or persistent symptoms, incorporating therapies like acupuncture, massage, hypnosis, and biofeedback can enhance their overall well-being. There are several actions individuals can take to alleviate the symptoms of depression. For many, engaging in regular exercise can foster positive feelings and uplift mood. Additionally, ensuring sufficient and good quality sleep consistently, maintaining a healthy diet, and steering clear of alcohol, a depressant, can also aid in minimizing depression symptoms. Depression is a genuine illness, and support is accessible. With a proper diagnosis and appropriate treatment, the majority of individuals grappling with depression can overcome it. If you're dealing with symptoms of depression, a crucial initial step is to reach out to your family physician or psychiatrist. Express your concerns and request a thorough assessment. This marks the beginning of addressing your mental health requirements. If you enjoyed today's video, do like, share and subscribe for more informative content like this.